Welcome to this Audiocast, produced by the Minnesota Department of Health Healthcare Homes Program. Hello, and welcome to Supporting Tobacco Cessation with Certified Tobacco Treatment Specialists. This is an Audiocast produced by the Minnesota Department of Health's Office of Statewide Health Improvement Initiatives and the Healthcare Homes Program. My name is David Kurtzen, and I'd like to welcome our guests today, Alyssa Wolf and Leah Berg. Alyssa and Leah, can you tell us a little bit about yourselves?
My name is Alyssa Wolf. I am on staff at Lee Carlson Center for Mental Health and Wellbeing, and I am currently contracted to work on the Anoka County Statewide Health Improvement Partnership, or SHIP grant.
Sounds great. Leah?
And I'm Leah Berg, a senior community health specialist with Washington County Public Health and Environment, and I work specifically on the Statewide Health Improvement Partnership, or SHIP strategies, the Worksite Healthcare and Tobacco Initiative.
Fantastic. Welcome to both of you. And I'm just going to launch right into our question set for today. And I guess the first question to ask is, well, why treat commercial tobacco addiction?
In the United States, there are still around 500,000 people who die every year from tobacco-related illness. So it's still a pretty big issue as far as mortality and morbidity. But if we look at it more on a statewide level, there's still about 14% of Minnesota adults who use tobacco products, and there are still about 20% of Minnesota high schoolers who have used tobacco-related products within the last 30 days, and that oftentimes includes Juul or other electronic cigarettes. So there are still a lot of people that are utilizing tobacco products. The interesting thing about tobacco-related products are that they are the only products that, when used correctly, will kill 50% of users.
We're hearing this is obviously a huge problem. How is it currently being addressed? I mean, what are some of the approaches right now?
Right now in Minnesota, the Minnesota Department of Health has a Quit Partner, which is a free or reduced cessation supports for individuals to help them with quitting tobacco use. So there are a lot of things that we're trying to do is offer low or reduced cost cessation supports and just trying to get the word out there to those who may be struggling with tobacco addiction.
So again, kind of moving ahead with this topic of partnerships, I want to ask, how do public health professionals, engage community partners? Who's involved? How do they interact?
As public health professionals, we have a lot of connections in local public health, whether that be to schools, our healthcare partners, clinic, behavioral health, mental health professionals. We do a lot of collaborative work, and I think a lot of what our work is also is networking. With the SHIP grant, we have a lot of funding opportunities and tend to reach out to like businesses or healthcare or clinic settings that may be related to the funding opportunities that we have.
And the partners that are ready to provide some type of service directly to their patients or their clients, we can actually help to fund the training of a staff member or members to become a certified tobacco treatment specialist. And then that staff member is able to provide in-person, individual, or group treatment opportunities in the form of counseling.
We're talking about these various kinds of partnerships and all this work that's being done. So I think a natural extension of that here is to ask what resources are available to sort of support the community partners to help build these collaborations and fund these efforts.
Through SHIP funding, we were able to send a few behavioral health staff within our communities to get CTTS certified. So the work really started with us trying to figure out what resources were out there and what these individuals needed. So we came together to develop this Twin Cities Metro Certified Tobacco Treatment Specialist Coalition and say, to our other SHIP colleagues around the Metro counties and say, hey, can you send this information out to individuals who are interested in this topic or that may have this CTTS certification? And kind of from there, we assessed what these individuals need to kind of sustain the work that they're currently doing.
How do we work collaboratively together on this? And you've been addressing this to some degree, but again, I'm kind of thinking about in a broader way with involving clinicians, public health, community organizations. Who's on first? How do you handle information sharing and communication? Could you speak to that, please?
The clinicians have got a wonderful opportunity to work directly with the patients or the clients through a process within their clinics when they're able to screen for tobacco use, and then they're able to address it directly with the patient or the client, whether that's providing an external referral to Quit Partner, or if they're able to do something internally with a certified tobacco treatment specialist and provide the direct service inside of their clinic is a wonderful opportunity. Now, outside of the clinic, when you're looking at community organizations, for example, the American Lung Association, they provide a lot of education. They provide a lot of technical assistance. They provide great networking opportunities. So those community organizations can really strengthen and reinforce the work that's happening within the clinic walls. Now, public health, we have a great opportunity to be a connector. We have a lot of connections within our communities. We're used to reaching out to clinics and other organizations. So we really have the opportunity to kind of bring people together. And oftentimes we have funding opportunities, especially with the grant that Leah and I are part of with SHIP.
What do you see as the work moving forward? How do you see the immediate future?
One thing when we think about our work moving forward is we are working collaboratively with MDH to create a network list of all CTTSs in the metro area, and hopefully our futuristic thinking would be that we would have a list of all CTTSs in the state of Minnesota, that we would have this sort of email list or network so that we can continue to share the work that they're doing and provide, educational opportunities, resources, and just kind of have that network opportunity to say, these are the things that are going on in my community, or these are the things that are really going well for me right now, and sharing kind of that information back and forth.
I think a big part of the work moving forward is looking at it from a social justice perspective. With there being so many disparities in the communities who are continuing to have high rates of tobacco use, and that's not by accident. Various communities have been specifically targeted by the tobacco industry historically, and that's what's causing a lot of disparities now with, for example, the BIPOC community or the LGBTQ plus community or behavioral health community having higher rates of tobacco use. So I think that's really where we're going to see the work moving forward, is trying to be very intentional about offering services and supports that will benefit communities that have previously been targeted, and to make more health equity a priority.
Just as we sort of wrap up this audiocast, wondering what kinds of resources are out there for listeners who would like to learn more about this, more about tobacco cessation, more about CTTSs, and more about these community public health clinical partnerships to address this issue.
Some resources that would be helpful: the American Lung Association of Minnesota offers really great resources, and specifically for providers who work in the mental health and substance use disorder field. They have a statewide coalition called the Lung Mind Alliance that addresses this commercial tobacco use. Looking into Quit Partner Minnesota is a great opportunity for partners who have the capacity to refer externally. For partners who are interested in doing internal services, like this certified tobacco treatment specialist, there are trainings available on the Council for Tobacco Treatment Training Programs website. And also SHIP, the Statewide Health Improvement Partnership. Every single county and most of the tribal nations within Minnesota boundary participates in the SHIP grant program. So that would be an opportunity as well to reach out to local SHIP partners for funding, and for other aspects with the technical assistance.
Leah, would you add any other resources to those?
I would also just add the Association for Non-Smokers of Minnesota, or ANSWER.
Listen, we've reached our time for today. I want to say thank you to both of you so much for agreeing to come on here and participate. I want to say thank you to our listeners as well. Again, this audiocast was sponsored by the Minnesota Department of Health's Office of Statewide Health Improvement Initiatives, as well as the Minnesota Department of Health Healthcare Homes Program. And I would encourage you also, if you're listening, to visit the Healthcare Homes website for more audiocasts, as well as other learning opportunities. Please visit the Minnesota Healthcare Homes website for more resources to help you deliver patient-centered, team-based care. Thanks for listening.